Good afternoon. My name is Haneen. I'm an occupational therapist in the spinal cord injury unit. We are going to talk about frozen shoulder today. Frozen shoulder is a condition of pain, stiffness, and limited range of motion due to scar tissue formation on the shoulder joint. Main features of the frozen shoulder or adhesive capsulitis is limitation in the range of motion in all the movement of the shoulder joint, which is crossing midline or overhead flexion or overhead movement, or even behind. The cause of frozen shoulder or the adhesive capsulitis is unknown, but it may be happen after injury like stroke or diabetes or spinal cord injury, or overuse of the shoulder joint. Assessment of the frozen shoulder is via assess the range of motion, to test the range of motion in all direction, in all movement, to see if there is a limitation or pain in this movement. So if there is a limitations in all of the movement of the shoulder joint, it may be the frozen shoulder one of the conditions that we have. A frozen shoulder is three stages: freezing stage, frozen stage, and thawing stage. Freezing stage, which is the acute phase of frozen shoulder, which the patient will experience pain, untolerated pain sometimes, and the pain will aggravate with the movement. So if we start vasoconstriction in this phase, will cause the patient more pain. So the more recommendation is the patient to start the painkiller first and to rest shoulder until the pain is free. Second stage is frozen stage. In the frozen stage, the limitation may be more of the range of motion, but the pain will be less. So in this stage, we will start the vasoconstriction for the upper extremity or for the shoulder joint, and as long as the patient can tolerate it. So we will not increase the vasoconstriction for the pain, over the pain. So as long as the patient can tolerate the pain, if there is a little pain, it's fine. We will do our vasoconstriction on that level. Thawing stage is the stage of movement. It means that the motion will be returning, and we will enhance or increase our gradual vasoconstriction as long as it's not aggravating pain. So if it's aggravating pain, we have to stop. But in this level or in this phase, we will not experience pain at all. The treatment of this this condition will start. It depends on the phase. So if the patient experiences the first phase, which is the freezing phase, the treatment will be restricted to the medication to decrease the pain and decrease the inflammation. In the second and third phase, we will work on range of motion exercises, gentle stretching to prevent further tightness and to improve or enhance shoulder movement, pain with the pain-free limit. So when you do passive stretching, just make sure that the patient can tolerate the pain. You have to, for example, if I want to do flexion in the shoulder, so I have to reach the point that the patient can tolerate and hold for 15 seconds and then decrease slowly. So gradually we'll increase the range. It depends on the patient can tolerate. Do not force on pain. So if the patient experience pain, just stop and hold on that end point of range of motion. Usually each stage takes from 3 to 4 months to be transformed to other stage or to the next stage. When we start our range of motion exercises or shoulder exercise, we start first with some basic exercises and then increase it gradually, depends on the patient can tolerate it and with the pain free. The first exercise which we are going to initiate is the Bandoneon exercise. Bandoneon exercise is to let the patient face a stationary object like a table or something, and the affected hand supposed to be in his free side. Okay, so he will initiate, or his body will initiate the movement, circular movement or circular motion within the range that he can tolerate. Okay, or within the range with pain free. So I'm not the one who, I'm not forcing the movement, so I'm not doing this movement, no. I'm just letting the patient to gradually let the gravity takes my hand down and slowly do some circular movement after that, like what I'm doing now. The second exercise is the tabletop arm slice, which is to put the affected hand or the affected side on the table and to be close to the table. Okay, and then slightly slide your hand on the table and go forward, and then bend your back to that side until you feel the arm or the shoulder will be stretched. As we said, keep for 15 seconds and turn back slowly. Repeat for 10 repetitions or as the patient can tolerate. The next exercise is while supine. Okay, keep your affected arm tied to your body while you are holding stick by your both hands. Okay, your elbow is supposed to be 90 degrees. By your non-affected hand, you have to push the stick toward the affected side to make rotation, external rotation of the shoulder away from the body. Okay, so you have also to hold for 15 seconds, return back and repeat it for 10 repetitions or 10 times. Basically, in the first treatment or range of motion exercises that you want to do the patient, start with these 3 exercises until the patient can tolerate, or until with the pain free, of course, and then you can gradually increase the number of exercises. So now I'm going to show the extra exercises you can do with the patient if he can tolerate the 3 exercises which we earlier introduced. The second or the fourth one is supine passive forward flexion, which you hold the affected arm with the unaffected arm and slightly forward flexion, flex your shoulder to the max until you can tolerate. Hold for 15 seconds, sorry, and then slowly or gradually return it back. Okay, and then we can use the stick for bilateral use of both hands and also do flexion movement for both shoulders. Okay, and then hold, then gradually, and repeat also for 10 repetitions. The next exercise is the wall climb stretch, which I have to put my affected hand or affected side on the wall and slightly climb the wall, okay, toward the ceiling. So when I face this movement, I have to be close to the wall more to allow more stretch on my hand or on my shoulder. Okay, repeat, or sorry, you can hold first for 15 seconds and then repeat for 10 times as tolerated. Next exercise that I'm going to do is I have to face a corner and then place my both hands on the sides and then gently I'm going to bend my body toward the field. Okay, so I'm stretch now the external rotation of my shoulder. If I'm going to stretch the internal rotation, I just, for the affected hand, I'm going to put this one down. So I'm going to put this one down and this one up, and then slightly also gentle bend my body toward the field. Hold for 15 seconds and then repeat for 10 times. The next exercise for the adduction and abduction stretch. So first keep your both hands below your head, and then squeeze it together both, and then slightly open it or abduction for both shoulders together also. Hold for 15 seconds and then repeat the movement. So adduction, hold, and then abduction for both hands and hold. this is some of the exercises which we initiate to handle or for the appropriate intervention for the frozen shoulder. Usually the X-ray is normal for those type of patients, and it's not involved on the other side. So when you have it in one side, that doesn't mean that you have to or it will be involved the other side or the other shoulder. Also in the last stage of treatment, that if we work on passive range of motion, if we work on treatment, medication and everything, and it's not beneficial, they go through the surgery to remove all the scar tissues around the shoulder joint and to return back to normal. For the OT perspective, we are going to deal with activity of daily living. So I'm going for sure test the patient how to do dressing and dressing the upper extremity with the pain-free, and I will teach him some simple movement or simple approaches to dress or undress his upper or lower extremity, so he can manage it alone. So our goal is to return back to independency, and for sure I will give him recommendation for toileting, for bathing, so he will I will maximize the independency as much as I can. Thank you for listening. I hope this will be useful for all the clinical therapists who will dealing with such a condition like frozen shoulder. And I'm going, of course, to receive some questions from you as you find something it's not understandable. So I'm going for sure to repeat it or manage it during this hour, inshallah.